Can't hear you, Ron. Do you have your headset on?
Okay. Go ahead, Gary. Yeah.
Okay, it's 12 o'clock. We'll go ahead and call this yearly meeting of the Russell County Local Board of Health to order on Tuesday, February 22nd, 2022. Welcome everybody for being on this Zoom meeting. I will let, I guess, Jane, you need to do a roll call.
I can. Can everyone hear Gary okay?
Yes.
Good. Wonderful. Okay. So I'm just going to go through the list here. Dr. Miles, Gary Robertson.
Right.
Okay. Let's see. Oh, I need to change this. Terry Lee. Terry's not on. Dr. Von Grunigen. I did speak with her staff earlier, and she was supposed to be on the meeting, but I don't see her yet. Mickey Garner.
Present.
Don Cooper.
Here.
Good. Karen Dalton. There she is. I know I've already. She's had enough trouble muting her phone, much less unmuting it. Sherry, Sherry Helm, are you on here? That was Sherry texting me saying she was probably not going to be able, she's in a meeting and probably won't be able to make it. Dr. Jones. No, she was here somewhere. There she is. Connie Blankenship. Okay. Connie, are you with us? I'll come back to you here in just a minute. Dr. Popplewell, I did speak with him. He said he wouldn't be able to attend. And Dr. Wade. I will say Dr. Wade, hello. Yes. No, we can't hear you at all. No, we can't hear you speaking at all.
Can everyone hear me okay?
Now we can.
Great. I was saying a second ago, we're live on YouTube. So if somebody wants to do a roll call to make sure we have a quorum, and then y'all can get going.
Okay, that's what I was doing. You couldn't hear us, I think. Okay, so we do have a quorum present. We'll go ahead and get started. As I was going through, I wanted to say Dr. Wade, I did speak with him earlier last week. He wanted to send his appreciation for being on the board for the past several years, but he did resign his position. He is moving to Tennessee to be closer to his family. His son, daughter, or whoever is living down there, but he's moving closer to his grandchildren. So we will not have a veterinarian on our board until we find a replacement for him. But he did want me to relay his appreciation for everyone and that he has enjoyed his time on the board and send his best wishes to everyone. Okay, Gary.
Okay, next we've got the introduction of our new director, Miss Amy Tomlinson. She's taken over since last year's meeting. Mr. Crabtree retired. Amy, you want to say a few words to the board?
Thank you for the warm welcome. And I think I have a spot on the agenda later for just a few general comments. So I'll save that till the end and let you all take care of your business first. But it's a pleasure to be here with you all. Thank you for having me.
Next, everybody had in their packets of minutes of their last meeting, February, or whenever we had it last year. Anybody got any revisions or changes to that? And if not, I hear a motion that we approve those minutes.
I make a motion.
Motion by Dr. Miles to approve the minutes. Do I have a second?
I'll second.
Second by Dr. Jones. All in favor of saying aye.
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 Anyone opposed? Okay, that motion passes. Next, we've got our health education with Ms. Shirley Robertson and Tracy Aaron. They're going to give us some updates on the community health assessment, and community health improvement project.
Thank you, Judge. I appreciate that. Thank you all for allowing me to share a bit of information about the Health Policy and Promotion Department and what we've been doing and what we're working on as far as that's concerned. But in the past, the Russell County Health and Wellness Coalition used, of course, and you're all familiar with this, the MAP process, or the Mobilizing for Action Through Partnership and Planning. This was a community-driven strategic planning tool that we used in 2019, of course, to actually conduct 4 assessments to identify priority health issues here in, of course, Russell County. So, and those health issues, the top ones, of course, was chronic disease, tobacco, cancer, and also to obesity. Of course, through this pandemic, these issues were put on hold, of course, for a little while so that, of course, everybody could focus on the health of our community and COVID, of course. However, we are now revisiting those top priority health issues and updating data, of course, so that our coalition can determine if these issues are still going to be addressed, and then, of course, working on that shift, that community health improvement plan. We have a lot of that already completed, but we want to go back and revisit that to see if we want to look at some more development on that. The CHA, of course, the results, of course, of the assessments and the data, of course, has been updated, and that can be found, of course, on our Lake Cumberland District Health Department webpage. And those that are on the Russell County Health and Wellness Coalition, I actually emailed a copy of that updates yesterday to each and every one of you all. But like I said, these can be found on our website as well. So if you look again, of course, at the top 4 that I just said, as far as tobacco, cancer, obesity, and chronic disease, if you think about all of those as a whole, tobacco, cancer, and obesity can actually be put in that category as chronic disease, or I feel like they can. So in saying all that, we're continually working on that, and just wanted to take a minute to review also to some of the data that we found that stood out and was concerning at this point as you reviewed your handouts. That was included, of course, in your packet that was mailed out for each of you all to review. And I hope that you all had time, of course, to review those. And it kind of looks like this, my part is, if you all can see that. Okay, it's actually 3 sheets, but it's just some updated data, of course, on Russell County. So in that particular data, okay, as far as what I saw that was concerning and wanted to just bring out to you was, of course, the smoking rate for Russell. It's about 27%, which is compared to Kentucky, of course, at 24%, which shows that we still have some work to do, of course, to bring this percentage, of course, down in Russell County. And we continue, of course, to do that in health education by providing freedom from smoking classes, and also to utilizing our quit lines as well to our community. Another one that I wanted to bring up was the grandparents responsible for grandchildren here in Russell County. And according to the U.S. Census, it was 70.4. And so when I looked at that, I thought to myself, well, we know that we have a large percentage of grandparents that are raising their grandchildren, but also too, we know that we have a great number of grandparents that the children are utilizing their parents to be caregivers too. So that was another issue that I was looking at on these this data, because, and I think a lot of that is, we have had a lot of daycares in our community that have had to close because of COVID, but also too, not only that, even before the parents were utilizing the grandparents for caregivers. Also too, adult obesity, of course, is something I wanted to bring up in Russell County. Russell is at 35% according to the county health rankings, and that compares as far as Kentucky to about the same percentage. And I thought about this, and I thought with the way that groceries are and food is concerned, as far as how high it is, we think we'd all be skinny, but the obesity rate is still pretty high as far as that is concerned in Russell County. So we all know that healthy food choices, or healthy foods such as fruits and vegetables, are very much so very expensive. And then in saying that about the obesity, I think that also contributes to the rising percentage of people in Russell County that have diabetes. Not all, but some, which in Russell County is higher, of course, than the district, and also too in Kentucky. And so our obesity and our diabetes rate, of course, is about 15% right now. So lastly, two other things that I wanted to really emphasize on the handouts that I gave you were drug overdose deaths. Say that 3 times. They're higher at 24 compared to district and Kentucky as far as rankings are concerned. And then lastly, the teen birth rates are also higher in Russell County than the district and Kentucky as far as rankings is concerned. So we want to look at all of that, and when we revisit our CHIP, our Community Health Improvement Plan, we're going to share and bring out a lot of these different concerns, and also to this new data. But as you can see, we still have a lot of things that we continue to work on. And in conclusion, I just want to say that I'm so very proud of being a part of the health department here in Russell County, and being your health educator, of course, and also to being a part of the Russell County Health and Wellness Coalition. And that Health and Wellness Coalition, of course, it meets every 4th Thursday of the month at noon, and we have that also virtual. And hopefully in a few meetings, maybe next meeting, maybe not next meeting, but maybe in a few months, we're going to be meeting, of course, in person again. We're keeping our fingers crossed. But this Health and Wellness Coalition is compiled of many wonderful community partners who identify, of course, and are planning the task to make Russell County, of course, a much healthier place to live. So I encourage each of you all, to attend meetings. Like I said, it's the 4th Thursday of every month. Call me and let me give you a little bit more information about not only what we're doing, what we have done in the past, what we're going to be doing, working on, but also to give you some information on how that you can be a part of that coalition. So thank you so very much, and hopefully I'll see you next year at the meeting, okay? So thank you for letting me speak.
Hold on just a minute, guys. Can you all still hear us?
Yes.
Yes.
We can't hear you, so give me just a minute.
Turn on the video now that you I turned it off while you were here.
Dr. Miles, while we're giving her a minute, I just want to say to all of you all that
I'm gonna try and fix this without disconnecting everything. Pray for me.
can you guys still hear me? Shake
I
your
can.
head.
Yes.
Okay, all right. Well, anyway, I just wanted to say this while she's working on that, is that we do have a meeting this coming Thursday with the Health and Wellness Coalition for Russell County, and our guest speaker is going to be the new tourist commissioner or tourist person that we've got in Russell County, which is Miss Wilson. And so that ought to be interesting. So just a heads up on that. Okay.
I had a couple comments on your report, Shirley.
Oh, no.
No, it was a good report, but when I was going through, there was one thing that showed a decrease in our teen pregnancy, but then our birth rate was higher. And I didn't know if that had to do with personal choice, lack of access to abortions compared to the rest of the state, or what was the cause for that. And the second thing was, if you look at our problems, smoking, obesity, that sort of thing, a lot of that's related to the ACEs, the adverse childhood experiences, right, Holly? And as you see that, how it affects physical as well. And I know we're working on that through the high school, which is an excellent thing through that grant. So I think that's important for people to know how important that work is. So.
Oh, I just agree with you so much, Dr. Miles, and I appreciate you so much for those comments. And yes, the school is working on the ACEs, and also too, we're diligently working on that as well with the school. And I get that word out here in a minute, but anyway, but yes, that is exactly right. And as far as the teen rates are concerned, yes, there is a lot of different factors in that, and I'm glad that you brought that up as well. So yeah, and even ACEs, I think, really affect, our teen births and our teen pregnancy. But also too, there is some pretty strict laws as far as abortion is concerned with our Kentucky right now. You basically have to have, the way I understand it, parental guidance or parental permission for that. Is that correct?
At this point, there's actually something in the legislature that's going to demand that. At least one of the parents has to give permission for that and a decreased access. And I'm not promoting it. I'm just saying that's probably one of the factors, because as the rate goes down as pregnancy goes down, but the birth rate continues or grows higher, there's got to be some factors involved. And it didn't make any sense to me until I started thinking about it. But yeah, there's a law going through right now through the legislature. Even the abortion pill is actually what's being attacked in that law, and the distribution of that, requiring a physician exam, parental consent, that sort of thing. So we do have some pretty strict laws, and access, I'm sure, is part of the situation there. And again, I'm not promoting one way or the other, but that just kind of explains if somebody's looking at going, well, why are we having higher birth rates when we're having lower pregnancy rates? So
absolutely, I understand that totally. And also too, with this new Kentucky law, also too, there is there's a time frame there too that they have to wait, where that they can actually get counseling before the abortion, as far as the teens are concerned. So I was encouraged about that. So during that counseling, they can give them some options, of course. So yeah, so thank you so much for bringing that out. Now we gave her plenty of time. I'm going to quit.
What about,
There is,
Tracy, got anything?
Tracy, are you doing the this diabetes report, or is it just in the paperwork?
No, I am not doing the diabetes report. they actually couldn't be on today. So that's information for you all just to have to share.
Okay. So we can skip over that on the agenda, correct? I'm assuming, I guess we are. Okay.
Okay, next we've got the old business. You want to talk about the survey and fence to the board?
Okay, yes, let me get well, that actually may be new business.
Okay.
It may go in the new
We'll
business.
go into new business. And let's
Yeah,
talk about
just-
survey and fence.
Well, Ron, do you want to, well, honestly, what he's talking about is we got a quote last year on putting up a fence on the property line between us and some neighbors that were spending a lot of time on the health department property, doing some damage and that type of thing. But we just recently were able to obtain a survey of the property line, and that we have found that there are some buildings and trees and other things that are actually partially on some of the health department property. So that's going to create another situation that we may have to address at a later time. And I have some quotes in the paperwork that we'll go over here in a little bit that talks about what it's going to cost to put up a fence on the property line. But that's what Gary was talking about.
So we'll get to that later, and then we'll probably do the ceiling.
Yeah, all of that's in yeah.
Okay. No other old business in, this is all in the new business.
All of this goes in new business.
Okay. We need to set our tax rates for the coming year. Past several years, it's been 4.5 cents per $100 assessment. I would recommend we leave it that way, but the board's any direction they want to go on.
Yes, sir. We normally do that of course, we can do it however you want, but normally what we do is you do have to set the tax rate before you approve the budget, but we normally present the budget with the tax rates before you do that, so you can see how each tax rate that we give you affects the budget.
Are you going to present it, or is Ms. Ames?
Yes. If it's okay with you at this time, I'll present the budget, and if you guys don't have questions, I'll then go back for y'all to approve the tax rate.
This was on the agenda before the budget, that's why I asked that. So
Yeah.
we'll go to the budget.
Yes, we normally do list it on the agenda just to remind us that it does have to be approved first, but we normally present the budget first. So I'll go ahead and do that at this time. I'm going to share my screen with you guys real quick. Let me. Okay, can everybody see that packet on my screen?
Yes.
Okay.
Okay.
Okay, so I'm going to zoom in just a little bit, but there's a lot of columns here, which is why it has to be pretty small. So I'm going to first tell you how we are estimating and how we're arriving at our opening cash balance as of July 1st, 2022 for this upcoming year. The way we arrived at that, and we'll start here at the top where it says opening balance calculation at the very top of this budget. The balance as of December 31st, 2021 in your cash accounts was $664,299. We project the rest of the year based on what you've already received and what we projected last year that you haven't received yet in real property taxes, tangible motor vehicle, and then some delinquent and telecommunications tax, that you'll receive another $116,609 and a little bit of interest from your bank accounts of $166, giving you a total remaining 2022 year ended June 30, 22 receipts of $116,775. And that would give you total cash available as of July 1st, 2022 before remaining expenditures of $781,074. We are projecting before for the rest of the year, the following expenditures from January 1st until June 30, 2022. The first thing being there, your LCDHD operating expense at 2.8 cents. Of course, that's the fee to be part of the district. That represents half. You already paid your first half toward the end of November, early December. So that's already been collected by the district. And then we'll pay this other amount you're seeing here sometime around May or early June. There's a little bit of advertising and printing cost remaining of $268. Still have to pay for your audit. The audit's already been completed. If you remember, you guys have an annual audit due to the size of your receipts and the fact that y'all have a loan, you still have that big loan outstanding. That requires you to have a audit every year. And the audit fees are around $1,500. So we still have that left to pay to the auditors. Probably a chunk of this maintenance repair will not be spent. I'd say a good portion of it will be, but if you remember, every year we build in miscellaneous expenses to cover in case something really bad happens to the building, whether it be electrical work done or HVAC repair, things like that. So whatever doesn't get spent the rest of the year, obviously go back into your budget for this upcoming year. But projecting based on what we budgeted last year, you have another $43,898 to spend. You have another $965 in dues and subscriptions that we pay on behalf of the board every year. And then the board expense, more than likely you will not spend at the end of the year, but of course you could if we have another miscellaneous cost that could get put in there. But we normally spend that on having live in-person meetings for board food and everything. Of course, we didn't get to have an in-person meeting in this year. Hopefully we'll get to do that next year to be able to, and then we'll use the budgeted cost for that. We have remaining furniture and fixtures of $11,874, equipment of $14,900, and of course remaining debt payments that we pay every month. So this represents 6 months worth of principal and interest of $78,886. That'll give you a total remaining expenditures through June 30, 2022 of $78,886. I'm sorry, of $329,019, and that would give you an estimated opening cash balance of $452,055. And that's where I'll move down to our budget. So as of July 1st, 2022 through June 30, 2023, we are projecting that you'll have real estate property taxes of $412,925, personal property taxes of $100,232, and motor vehicle taxes of $51,181. I know you guys probably remember this every year, but just in case there's somebody who hasn't been on in a little while or a new board member, we always want to remind everybody how we come to that calculation. We get these, we get the property valuation sheets from the state, the Department of Public Health, who gets them from the Finance Administration Cabinet, the Office of Property Valuation. We take these numbers for all the various taxes. And we plug them into our calculator here, the sheet you're looking at right now, for all the various different taxes for Russell County. And then we plug in your rates here, and then we base it on a 95% collection rate in case there's some unforeseen things that cause you not to be able to collect all of your taxes and fees for that year. And that's how we arrive at the numbers I just presented to you a second ago, showing now again right in front of me on this budget. The delinquent tax collections are always hard to estimate. I tell every board that's the hardest one because it varies month to month. It varies year to year. I think some years you get 12,000, some years you get 6, some months you get a couple hundred, some months you get a couple thousand. It just really depends on various things, whether they're catching up on billing or whatever. It's just very hard to estimate that. So we normally estimate that based on what you're planning to, what you've received year to date. That's how I kind of project the following year, and based on that, we project you to spend or to receive about $8,944 in delinquent tax, and then project you next year to receive $633 in telecommunications tax. And then of course, a little bit of interest income from your bank accounts of $282. That would give you total budgeted receipts of $574,197. And that would give you total cash funds available of $1,026,252. Just so you guys are aware, I'm gonna highlight this so you understand where I'm presenting here. If I can back that off, hang on just a second. Sorry. Okay, I just highlighted the column right here that I'm presenting from. So The middle, I'm presenting everything from this current rate, the 4.5 cents that the judge was talking about a second ago. At the very end, I'll show you the results of the break even and surplus. But since normally you guys approve this rate, and we always present it from the current rate. So as I continue to go down, you'll see me working from this middle column here that says proposed budget at current rate. So your budgeted expenditures for the year are as follows. We have, of course, the 2.8 cent fee to be part of the district. We estimate that to be $369,625, based on, once again, plugging in all the figures that I showed you before from all the tax rates. We have a projected building maintenance repair of the following expenditures. Landscape maintenance and snow removal of $3,500. I have raised that a little bit this year because it's the snow removal cost and salt and everything has gone up. As with everything else, labor and everything has gone up. So I've increased that a little bit this year to cover snow removal, especially if we have a bad snow year like we did this year so far. So had preparations in there for that. A couple of the following expenditures, if you have questions, you can either feel free to stop me or wait till the end, but Jane can answer some of these questions. And all the quotes and backup for these will be in your packets. If you want me to scroll to one of those, I can do that. So there is budget this year, parking lot sealing and striping. It's much needed over there at Russell County for $7,000. Parking lot lighting repair and upgrade to LED lights of $15,000. Where they had sprinkler pit flooding issues. They're doing sprinkler pit flooding prevention measures of $10,000. And here's what. And we're doing a property line survey of $3,500, which I think is associated with the fencing, if I recall. And then flagpole repair of $3,000. And then property line fencing, which is what they were just discussing, estimate of that at $10,000 to get that done. And then I explained before, we have miscellaneous costs of $15,000. That's to cover if you lose some HVAC units during the year. Those are getting very expensive, or like I said, just needing something major done to the building, whatever that may be. So we don't have to have a special call board meeting every time we need to cover an extra expense. It gives us a little cushion to be able to cover those fees that come about. That gives you a total building maintenance and repair of $67,000. Moving on to furniture and fixtures. We normally budget for seasonal decor of around $1,000 for any kind of building up, just things to replace in the building or things to make the building look a little nicer. And of course, miscellaneous costs for anything that comes up. More chair. We need to replace chairs or tables or just furniture and fixtures that need replaced or they get broken. $5,000 in there for that. That's giving you total furniture and fixtures of $6,000. Moving on to equipment. If y'all remember, about 3 or 4 years ago, we started splitting out the equipment in 2 miscellaneous categories. The first one being miscellaneous computers and related equipment. And this is really anything related to IT equipment. We're such an IT world now. All these stuff is becoming so expensive. This will be a category related to anything. If we need to replace laptops, if we need new print, if the printers break or fax, we need new fax machines, copiers, anything IT kind of computer related, small servers, things like that would go in this budget, covering that for $10,000. Of course, like I said, anything that's not spent, if we have a good year and the IT stuff stays in good shape, all that goes back into your budget and you won't have to spend it. Sorry, I scrolled down a little bit. If you guys remember, you have the automatic generator. We pay somebody, the guys who I believe installed it, to come once a year to do the annual maintenance checks on that, to top off any fluids, check, make sure everything is wired still properly and everything looks good. So we pay them a $500 annual maintenance fee for that. They're wanting a clinic paper shredder. The Russell County office asked for that for $1,000. And then, of course, any other miscellaneous costs that could come up. And that's why these are smaller, because we cover a lot of that under computers. That's most of our equipment. But there could be other things like medical fridges, if they need maybe a small medical fridge, if that goes out, or any kind of utensils the nurses use or things like that, that go under equipment. Those are other things that could fall under there if they're needing those for $5,000. That would give you total equipment of $16,500. Of course, for budgeting another audit next year of $1,500. Advertising and printing costs, we normally budget that around $300. And then dues of subscriptions, these some of these costs keep going up, so we budget that at $1,500. These are the organizations we tend to be a part of every single year: CalBO, SPGE, and KPHA. And then, of course, if we get to have in-person board meetings next year, we'll plan to spend this cost of $500 for food and everything for the board meeting. And then this is your total of your annual payments for the First National Bank building loan for next year of $150,772. And I got that. If you go to your next page, you'll see where I came up with that calculation on the following page for how I calculated your First National Bank loan. And that comes from the bank amortization schedule that's provided to me. That would give you total budgeted cost for the year, for the fiscal year ended June 30, 2023, of $620,698, with a balance of cash remaining of $405,554. And that would give you a net deficit, if you approve everything on the budget, of $46,501. Now, I think we agree that most years, like I said, if you don't spend some of these big chunk miscellaneous categories, a lot of that goes back into your budget. And if you collect more fees than we budget, of course, which you tend to do at times as well, this budget will more than likely be more around the ballpark of actual $15,000 deficit. If we have a good year next year, probably around a $15,000 to $10,000 deficit. So not as bad as it looks here. And to kind of prove that, I want to go real quickly before y'all go back to the rate to show you that in Russell County, if you look down at Russell County right here on this sheet, this shows you where you guys have averaged over about a 9-year period of deficits and surpluses. And if you look in this category that shows the negatives and positives, you'll see that a lot of years you did surplus. There was some years before that you had some deficits, but a lot of years you normally come out okay. So that rate, even with the loan payments, has served you pretty well. But like I said, obviously, if we did have a bad year for some replacements, it probably would be a deficit. So like I said, it seems like that 4.5% rate has served you pretty well. But anyway, that's the budget. I'll leave this time now for any questions you guys have. And if you don't have questions, obviously this is when you'll move to talk about the setting the tax rate.
I had a question. With this COVID money, I don't know if it affects the budget or not. That's why I want to bring it up now. Is there a way that we can give these employees incentive pay, one-time pay with this COVID money, like the hospital done and a lot of the counties has done? Is that something we could do for the employees of the health department?
I'll let Amy answer that, but I'm guessing she's going to tell you not such great things there. So,
Well, how much COVID money did the district health department get there?
The health department hasn't gotten any COVID money that wasn't service related for vaccines or contact tracing or something along those lines. We didn't get the American Recovery Funds like the county did, and some of those that were used for the hero pay incentives and different things. That went to county governments and state governments. So we have not done that. All of our staff did. The only thing that we were really able to do is the district staff approved, or the district board approved, a one-time $1,000 bonus at the December board meeting as an appreciation for our staff. And that's about the extent of what the district board is able to do. It's nothing compared to what some of the county governments have done with some of the Recovery Act funds that they received. And my staff ask a lot about, when they would be able to be qualified as hero pay and essential workers and all that stuff. And I don't have an answer for that. I've gone to Frankfurt, I've asked the local county judges and different things. And the local judges, it's my understanding, the local districts could choose to do that with some of their local funds, but none of them have in our 10 counties, because that opens up a whole nother can of worms. And that would basically take every penny that the county's got to do that for all the different entities that would deserve it. EMS services, county, health department staff, emergency management, responders, long-term cares, all of those groups would fall under there, and that would take everything. So I haven't had a lot of luck in researching that option. I just know that from the health department's perspective, we didn't qualify for that pot of funding. So we've done everything we can for our staff at this point.
Amy, what about the PPP? Was the district health department eligible to get help on that, on the payroll, reimbursed 3 months or whatever?
That was before me in this role, but I think Ron looked into that at that point in time, and we didn't qualify for that either. That's the paycheck protection, whatever, Ron. And I believe I remember in the height of COVID response that you were asked to look into that, and I'm fairly certain you came back with the no go on that also.
Yeah.
I don't remember the reasoning.
Right. I don't, there's been various ones that have come. Unfortunately, you know, the wording that really hurts is sometimes, I'm sure Amy's explained to you guys before, is we're considered quasi-government. So sometimes funds go to the state, which we're not technically state, and sometimes funds go to the local government, which we're not considered local government. And unless sometimes there's some decisions made with those funds, like Amy was saying a second ago, from the people that receive those, sometimes we kind of get left out of that pot. But in this particular case, we have not been authorized with any of the funds that we are receiving. And we have received a chunk load of COVID funds, but not one penny has been allowed, to our knowledge, for any kind of salary cost that would be like an incentive pay, like a bonus. It all has to be service based, like Amy was saying before. So it has to be something we're using as a COVID service, not as actually an additional amount to be paid to the employees.
All of ours was actually direction. We had to pay anybody that we were responsible for paying their salaries, we were allowed to. Of course, that, like you all, and the ambulance board, it's a separate taxing district. The hospital employees, they're separate taxing districts. We had a lot of calls, but they were not under our direct payroll. So that's why that question came up.
Yeah, and that's the case in most counties, Judge. That's exactly what we've ran into, is that we don't really fall under the county jurisdiction, and we don't really fall under the state either. We're as Ron was saying, we're quasi, so we're kind of caught in the middle on all of this, which is a bad place to be in this situation. But the governor's budget that's going through the legislature now, and with the House and the Senate and all that, there is still a possibility of some hero pay, I think, incentive in that. I don't know what the likelihood of that passing is, and if it did pass, you know, I don't know what the chunk would be by the time they declared who all was considered essential or who all was considered a hero or all that. The amount that would be awarded for each person would probably be so small it wouldn't make a huge difference and impact on anybody anyway. But I don't know. I've tried to research every option on behalf of my staff, because I know that it's almost heartbreaking, you know, to look at all of the things that's gone on and the people who have gotten it, and to know that I can't do something for my staff who have also been responding from the beginning also. Not that I begrudge it for anyone. I certainly think everyone who's survived this pandemic over 2 years has earned every penny, you know.
Our direction of the feds was that, you know, anyone that worked at home wasn't allowed. So we had a few people that worked under county government that worked at home.
Yes.
And they weren't allowed anything.
Yes, I think. Yeah, I did understand that to be the case too.
And Amy, the hospital employees got $1,000 as well. You know,
yes.
What you all got in December. So they got the 1,000. They didn't get the 5,000, but they got the 1,000.
Yeah. I think that's pretty standard across, from what I've seen from responders and healthcare entities across our district, at least. That's what we've qualified for, and that's what we've gotten. We didn't get the bigger bonuses.
Any more questions about the budget? What's the recommendations on the tax rate?
I'm not going to make the same. Yes.
Got a motion with Master Garner to leave the tax rate for the coming year 4.5 cents to 100. I have a second.
I second, Dr. Miles.
Dr. Miles second. All in favor of that, saying aye.
Aye.
Anyone opposed? Motion passes. Okay. Now we need to approve the budget as given to us. I need a motion to approve the budget that was presented by Ron.
Unlike both.
Motion with Manager Garner to approve the coming year's budget. Have a second.
I'll second the motion.
Second with Dr. Jones. All in favor of saying aye.
Aye.
Anyone opposed? The budget is approved. We've got some board members that terms will expire in December of 22. Karen Dalton, Terry Lee, Dr. Wade, which we know he's not going to serve again, Don Cooper and Connie Blankenship. Are all these people willing to be reappointed, or Jane, or you talking to them?
I have the letters for Karen and Connie and Dr. Lee. I have their forms to be submitted.
Well, I know Don Cooper's doing the same thing. He should have done. It.
Oh, he ain't doing
He's
nothing.
retired.
Hard is.
Are you willing to serve, Mr. Cooper?
Yes, sir, I am.
Okay. Man. So we need a motion to reappoint those four, and are you gonna try to contact and get a veterinarian to serve? Or?
Well, the only,
God, I guess, Dr. Coffey, right?
he's about the only one left in the county at this point. So I can contact him and see if he's willing to serve.
Jane, I ran into this in another county also with the same situation, a veterinarian. And according to the regulations, if you can't find a veterinarian to fill the spot, it can be another person in the community with knowledge of the health situations and that kind of thing. So just a consumer, I believe.
Okay.
And it wouldn't have to be a vet, but of course we want to reach out to our vet first.
Yes.
But we do have options there if we can't fill that position with someone else.
Okay,
That sounds
good.
good.
Thank you.
And we'll need that in writing, that resignation in writing, so we can get that cleared up at Frankfurt level and take that off of our roll and everything.
Okay, I will have him send me an email, or I'll have him scan me something probably, because I think the day he called me, he was literally moving that day. So
Oh, wow.
yeah, he was like, see ya. I enjoyed it, but I'm gone. So, but yes, I will. Thank you.
Okay, I hear a motion that these other four are willing to serve another term. We reappoint them.
I'll make a motion.
Motion with Manager Garner,
I'll second.
second with Dr. Miles. All in favor, saying aye.
Aye.
Anyone opposed? Thank y'all for serving another time. Now we've got, what, two local members on the district board,
Dr. Miles and Dr. Lee.
Dr. Lee and Dr. Miles. Both of them willing to serve again on the local board, or some,
On the district board,
yes, I'm sorry, district board.
I would,
You
yes.
say yes, Dr. Miles?
I will unless someone else wants to do it.
About Dr. Lee, she would.
Yes, to my knowledge, she is, yeah. She is.
Do I have a motion that we reappoint both them for the district board as local members? Serve on.
I'll make the motion.
Motion by Dr. Jones. Second by Manager Garner. All in favor of saying aye.
Aye.
Anyone opposed? Okay, next we need to review the 2021 audit. Who wants to handle that?
Ron's going to go over that again. I think this is something that we used to present to you all just through an email or a packet, and Ron has decided to do that at this kind of meeting so that it allows chance for opportunity for questions and any kind of comments. So this should be after all the quotes and everything in your all's packet, I believe. It looks like around page 16 of the packet that I have in front of me, so it'd be somewhere around there. Ron, can you share your screen and work on the financials and the audit?
Yes, Amy, I may have misheard, not to go back, but did they talk about the secretary?
Oh, no, I should have said that. So sorry. We didn't have an election of officers on here. We just did the appointments of the board and everything. So we will need to do election of officers, the chair and the vice chair.
Is that at the very bottom?
It is. So sorry. Yeah, I see it now, Jane. Sorry. Ron threw me off asking questions.
It's usually on there somewhere.
It's at the bottom.
Yeah.
I should have known. Yep. We'll get to that. So we haven't missed it yet, Ron.
Okay, good. I wanted to make sure that was in there. Okay. I apologize. I am going to share my screen. 1 second. Okay, can everybody see my screen?
Yeah.
Okay. In prior years, we had normally sent out financial statements to you guys via email or via regular mail, sometime in the September, November timeframe, depending on how long the audit took to get done. It seems like each year, just because various circumstances, depending on how many audits that our auditors are completing, they normally can't get it done till at least, it seems like October, if not longer. So I saw it kind of pointless to start sending financials to you guys in November, December, especially since our board meeting is so close after that. So I moving forward, starting the year I'm presenting to you now, and every year thereafter I present to you, I'm going to start presenting you the financial statements for the year ended prior year. And that way you'll have it in your packet. So you'll have the financials there officially in your packet. And it gives you opportunity to ask a question if you really needed, if you wanted to ask something about the financials. So of course, our most recent year end was June 30, 2021. So I'm going to present how those financials turned out. And then after this, I'll just move right into the audit. And of course, you have questions about it, either you can ask that when I'm done there, or you can stop me, whatever you choose. I won't spend a lot of time on the audit because it reflects pretty much exactly what's on these financials. But I will read a couple notes on the audit. For the Russell County Public Health Taxing District for the fiscal year ended June 30, 2021, on July 1st, 2020, you had a cash balance of $449,219. During the year, you had total receipts of $556,433. That was comprised of the categories we talked about before: real estate, tangible, motor vehicle, delinquent, other taxes, and interest income. Giving you a total receipts or giving you a total cash available before expenditures for the year ended June 30, 2021 of $1,005,652. The total expenditures for the year for June 30, 2021 were $514,633. Once again, that was comprised of all the normal costs. As you can see here: advertising, professional services for the auditor, maintenance and repair, district management fee to be part of the district, materials, dues, miscellaneous costs, which are very little because, like I said, we didn't have a board meeting, building improvements, equipment, and then of course your principal and interest on your big loan there for the building. That gave you that left you with a cash balance at the end of the year, June 30, 2021, of $491,019. As you can also see reflected on the balance sheet on our page here now, on this next page, which is should be page 23 of 36 of your packet, showing that reflection. So that just gives you a breakdown of the difference in showing our operating account and then our opening balance, equity, and retained earnings. Of course, net income. This next one is probably one you're a little more interested in normally. This one is a profit and loss budget to actual. This one shows where we budgeted in each specific category, whether it be revenue or expenses, and showed how it turned out that we spent. As you can see, in total receipts, we actually came out on top. We budgeted $528,000. And with the health departments, the COVID didn't impact us very much with this, which was good. And we actually received $556,000. And then in total expenditures for the categories, you had underspent, which was good, of $24,900, which of course is mainly your categories of miscellaneous. Y'all didn't have a lot of horrible things happen to the building last year. You got to keep a lot of the funds you had budgeted since you didn't have to spend it. So like I said, this would have been a much different scenario if that actually came to fruition. But it's a pretty quiet year, as you can see, from a maintenance and repair and furniture and equipment perspective. So nothing too big causing you to have a surplus of $41,800 through June 30, 2021. Moving into the audit now. Once again, I'm not going to spend time on the actual financials, but I am going to read two things that the auditors reported for us to tell you how our audit went. So if on page 29, I believe, of 36, which will be this, I think the second page of your actual audit for the independent auditor's report, under the paragraph titled Unmodified Opinion on Regulatory Basis of Accounting, the auditors told us that in their opinion, the financial statements referred to above present fairly in all material respects the assets, liabilities, and fund balances of the Russell County Public Health Taxing District as of June 30, 2021, and the respective revenues and expenditures for the year then ended. So from a financial statement perspective and from looking at all the financials, the auditors found us to have a very clean financial. So everything looked good from an accounting perspective there. Moving on, I'm going to skip past once again the financials part of this. I did want to make note that they did leave a COVID-19 pandemic note. I'm going to read it real quick, even though it really doesn't impact us, but I wanted to read it. Since early 2020, the COVID-19 pandemic forced certain restrictions in the U.S. and the state of Kentucky. The economic impact of the pandemic could result in a negative impact on the taxing district's revenues. The duration and pervasiveness of the pandemic are uncertain as of the day of these financial statements. The taxing district is continuously evaluating the impact of COVID-19 on its operations and finances. And so far, it has not hurt us from that perspective, from a financial perspective so far. So from a revenues, we've been just fine, and from expenses, we for the most part have been just fine. So luckily, even though the auditors had to leave that note just in case something did happen as a result of the pandemic, we have been okay so far. Moving on to the report that the auditors give us for the government, how we are in compliance with government auditing standards. I want to read the last paragraph on page 35 of 36 of your packet under the paragraph titled Compliance and Other Matters. The very last sentence says the results of our test disclose no instances of non-compliance or other matters that are required to be reported under government auditing standards. So once again, they didn't see any issues with how we're in compliance with government auditing standards. We had a clean audit. So that's what we've had. That's what we've always had, at least all the way dating back to as far as I can see, to my knowledge, with you guys. So you guys always have had a clean audit. So once again, that's good. That's a good report from the auditors. And I believe that's all I have. So now I'll take any questions on the audit or financials or anything else you guys have for me.
Okay, now you can talk.
Anyone got any comments or questions for Ron? We need to.
We can't hear her now. We can't hear her now.
Sorry, I think we won't need a motion on the financials or anything, but I think we do need a motion to accept the audit, the
Yeah,
report.
we need a motion to approve the.
Yeah.
Audit report.
I make a motion.
Who made it? I'm sorry.
Connie Blankenship.
Okay, makes a motion. Do I have a second?
I'll say it.
Second by Mickey Gunner. All in favor of saying aye? Opposed? So the audit report is approved. Okay, thank you, Ron. Next thing, we've got comments from our new director, Amy Thomas.
I'll try to be very brief. I just wanted to introduce myself, I guess, to you all. My name is Amy Tomlinson. I was appointed the director for the health department last summer. So I think the official date was June the 14th. And Mr. Crabtree then stayed around and retired officially July 31st. So that allowed about a 6-week overlap between his tenure and my tenure. So that gave me a lot of opportunity to work closely with him and gain some knowledge, and I appreciate that. So my first solo day as director was actually August 1st. And while I'm new to the role of director, I'm not new to the agency. I've been here for over 17 years in various different roles. So I have a pretty good knowledge of the inside workings of the health department, which came in was very helpful during the first days of this tenure of mine, because August the 1st was my first solo day, and that's about the time of the Delta surge that we were going through with COVID. Mm-hmm. So we went immediately from that into then Omicron around the holidays, and it's been nonstop from day one of my tenure. So a lot of decision making and a lot of things that we thought were behind us actually weren't behind us, and we ended up having to do some rebooting, I guess, of some of our things that we thought were done. So besides COVID, there are still other things going on at the health department. There's still a lot of normal health department services going on. Our staff have taken on many hats during COVID. They have done contact tracing, they have done vaccinations, they have done testing, they have done all sorts of things. And I'm greatly appreciative for all of their willingness to pitch in and help and to be chewed out and fussed at and praised and all the things that everybody has gone through. It's been a roller coaster ride. But on top of that, they have maintained their high level of excellence on just their normal day-to-day services. They're still doing immunizations. They're still doing WIC. They're still doing diabetes classes. We still have syringe exchange going on in many of our counties. We still have just all sorts of awesome programs for our community. And that has not changed. That has not gone away. That has not diminished. So on top of everything else COVID has brought, it has really highlighted the fact for me of how important the health department is in our communities. And we are extremely thankful for all the partnerships that we have had. You know, we've always worked well with our community partners, but COVID has just upped that. It's just ridiculous, the amount of partnerships now that we have and the people that we've been able to work with that we didn't routinely work with before. And we are extremely thankful for all of those partnerships. I will say, as a kind of a closing note, the health department, the Lake Cumberland District Health Department, started in 1971 with 5 counties. We were the first district health department in the state. And then in 1982, we added 5 additional counties. So we have the 10 counties now that we all know as Lake Cumberland, that we've been a district since 1982. And so since this is 2022, we're looking at 40 continuous years of service to our area. And that is a huge milestone. We are the longest serving, we were the longest serving health department. I think we're the largest geographical region that's served in the state. So we have a major milestone approaching us. And I really want to be able to highlight that this summer and, do some celebration for our staff, for our communities, and bring our partners in to that and just do hopefully we survived COVID and look where we are now, kind of a big celebration to highlight the partnerships and the history of the health department. I've been looking back at some of the history and some of the old minutes and the board minutes and different things and some photos. I've actually seen some photos and some of the black and white photos from like the 70s of and even probably before that, maybe even before we were officially a district. I've seen photos of health department nurses giving the sugar cube polio vaccines during that time frame. And I thought, as much as we like to think how far we've come, we're still giving vaccines. We're still going through these same things. So as much as it changes, some things stay the same. And I'm thankful for the continuity that we have, the providers and the partnerships across our counties. And I just want to highlight that this year and kind of build on that and just celebrate. I think we've all come through this together, and the partnerships, like I said, are just, I'm so thankful. So I'm grateful for the opportunity to serve in this capacity. I'm always open and available to your all's questions or comments. If there's things that you need to know about your county or your community or that I can help with, please reach out to me at any time. Jane has my cell phone number and my office number, and Judge Robertson can get in touch with me anytime. So if you all need that information or want that information, just reach out to them or to me, and I will make sure you have my contacts. And I'm thankful for all of you. Thank you for this opportunity to serve.
Thank you, Amy. I want to say I appreciate everything you've done, and also Sean while he was here. I guess it'd be 2 years. 2 years ago next month, this all started. You all have provided us with some type of update, at least every day during the week. And when it first started, we even had it 7 days a week. I've tried to pass that on, and I believe most of the citizens in this county are very appreciative of us sharing that information with them. I've had a lot of comments from people about that, so I appreciate you all sending all that info out to us every day.
I think one of the biggest challenges about this whole thing, Judge, has been trust and information in people that you can believe, and who do you go to, who do you trust with your information. And we wanted to be that upfront from the beginning. We wanted to give everything we had, be as transparent as possible, tell you what we knew from day one. And of course, it changes over time. That's how science operates. That's how the healthcare field works. And as you learn more things, things change and it goes on. And a lot of the public doesn't understand that or doesn't appreciate that fact, but that's exactly how this should work. We shouldn't be doing the same things now that we were doing 2 years ago. So I'm just thankful, that we have learned some of this stuff and that we've been able to provide information and trusted information to our communities and to our partners.
I just want to say that I really, I'm speaking on behalf of the medical community now, and Collie and Dr. Miles would agree, but until you've worked in this situation, nobody really knows how hard you guys have worked over the last 2 years. And we really, really appreciate, because we didn't even know what to do throughout many situations in this last 2 years. And you guys have been the first people we would call, and always would be helpful. And even if you didn't have the answer, would try to find us the answer and get us a solution. So it hasn't gone unnoticed in the medical community, and we really appreciate it.
Thank you very much. I'll pass that on to my staff.
Man,
Anybody else got anything? We've got a couple of proposals I think we need to, the board needs to vote on, correct? The fencing, or is it included in the budget? You only had one bid on the fencing bid.
Yes, well, yeah, there is no other place
Okay.
to get
And that's
fencing.
not the right price.
Yeah, it's going to, the Stevens Pipe and Steel quote on that, that was from last year. I'm sure the price is going to change, but since I didn't get the quote, or since I didn't get the survey until just Wednesday of last week, because no one would come do it until Wednesday of last week. I didn't see a reason to keep getting quotes before I knew where to put the fence. So I'm not sure I'm sure the price is going to be different. However, Stevens Pipe and Steel, as they keep telling me, even though if I get multiple quotes, it's still going to be Stevens Pipe and Steel, because they are the only place that owns fence. Even if the company is different, the company name is different, it's still going to be Stevens Pipe and Steel. And so I keep being told, they told me they could easily get me 3 quotes, but it's all going to be their fence regardless. So I said, okay, no matter, even if I went to any of the surrounding states. So I don't know what to tell you about that, about getting multiple quotes. There can be different names on them, but it's still going to be from the same place. So I really don't know what to do about that. Yeah. So if you want me to go ahead and start getting the go ahead on that, if you all don't have a problem with that, because it is going to be quite involved with, like I said,
We'll have to get the boundary lines established before.
It's going to be, this is not going to be a quick project. It will probably take from now until maybe this time next year before it's said and done to get this done. So if you all want to give me a vote to go ahead and start the project, I would appreciate that.
Yeah, I would ask for a motion to give Jane authority to deal with probably let our local county attorney send these property owners letters informing them that we own the property and they need to remove whatever they own that's on their property. Be my suggestion.
I have to take 4 foot fence. I'll make that motion. We give her authority to do whatever's necessary to contact the county attorney, whatever's necessary, and later put the fence up.
Okay, motion by Master Connor to that effect. Do I have a second?
Second, Don Cooper.
Mr. Don Cooper seconds. All in favor, saying aye.
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 Anyone opposed? Motion passes. Okay, next we've got 2 bids on our parking lot ceiling, is that correct?
Yes,
Except on the other bids, on anything we have, just these parking lots.
Yes.
ceiling,
I think those are the only things that were,
Everybody's got that in the packet. I think we've got one from McQuarrie's and one from Selby's.
those are the 2 locals that are in the county.
What are the amounts of those?
Quarry is $59,44.50, $5,944.
Yeah.
Selby's is $8,085.90. That's for striping, that's for sealing it and striping it.
That is correct.
Both of them bid ceiling and striping, is that correct?
Yes. Yes, they did. There was a pretty big difference in the pricing.
So I assume the board won't go with the lowest bid. But if they do, I need a motion for that effect.
I'll make that motion.
Motion by Dr. Miles to take the low bid on the ceiling and striping. Do I have a second?
I'll
second.
second.
Second
Go
by
ahead,
Dr.
Stephanie.
Second by Dr. Jones. All in favor, saying aye.
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 Anyone opposed? Motion passes. Any other bids to do with things?
That's it for me. No, that's the only bids. The rest of it is gonna be ongoing.
The next thing, I guess the last thing, on the agenda, we need to elect officers. I won't be here, it's your next year's meeting, so if you all want to elect the chairman,
Back in, work.
if you want to elect the chair, will get you through the end, go ahead, I have no, I will not be offended.
Well, I don't know about that. I'm, huh.
I'm leaving the first Monday in January.
Well,
2023.
so you wouldn't come visit us, you don't think? Yeah, we might be able to feed you by next year, Gary. Surely you'd come do that.
We need to do a slate of officers, let's see, a chairman, a vice chairman, and
Vice chairman is currently Don Cooper.
he make you a good chairman.
Yeah, I think you would do.
Since he's retired, he doesn't do anything anyway, play pickleball. Be a good job, Don Cooper.
Don, will you serve as president or as chairman?
For,
I think he's over there.
I think he's pretending.
Yeah. That's the best time to elect somebody who's not here.
Of course, the chair will be, once the position is,
The new judge.
yeah, the new judge will be.
That's fine, just have everyone do it.
Yeah. For the following year. Of course,
You could just leave him as the same.
Who's the secretary?
Karen, Karen is treasurer.
Okay.
The secretary was Sean.
Yeah, well, that's something we probably need to put.
So he wanted to be.
That is something that we need to address. With Mr. Crabtree being gone, he was serving as secretary for all of our local boards, in pretty much most of them anyway. And that allows the director to do some business on behalf of the board and sign some paperwork and make things easier for the process to speed along and not have to chase people down for signatures. So if that's the wishes of this board, I'm willing to serve as secretary to speed that process along and continue facilitating that as well.
I nominate Amy for secretary.
Okay, we got a motion by Dr. Miles, nominate Amy for secretary, replacing Mr. Crabtree. Second, Manager Garner. All in favor of that, saying aye.
Aye.
Anyone opposed? Amy, you're the new secretary. Now, you want to elect the chairman and vice and the treasurer.
We need to make a motion to accept the slate of continuing the officers as they are, or to elect new officers, whatever the preference is for the board.
Karen willing to serve as treasurer again. Jane. Karen Dawson.
Karen, are you willing to keep your position?
Yes,
Okay.
yes,
And I'm
Of
sure
course.
Don is too.
Yeah.
I will.
I make a motion to keep the slate the same.
I'll second.
John, second with Dr. Miles. Keep the other officers the same, chairman, vice chairman, and treasurer. All in favor, saying aye.
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 Opposed? Motion passes. Okay, do we have any other business? Anything?
No, that is it.
Amy, you have anything else?
No, sir. I'm finished. Thank you.
Okay, do I hear a motion, the meeting be adjourned? Motion from Asher Conlon.
I'll second.
Second by Connie Blankenship. All in favor, saying aye.
Aye.
Thank you all, we're adjourned. Appreciate it.
Thanks, everyone.